A title appears, Trauma-Informed Healthcare. A logo, NSVRC, National Sexual Violence Resource Center. A graphic appears, Kim Day, RN, Sane A, Sane P, Forensic Nursing Director, International Association of Forensic Nurses, Maryland.
As a healthcare provider, my goal is to make sure that the long-term health consequences of sexual violence, which can impact a patient or a victim their whole life, are mitigated by coming to our program. I think that the work of sexual assault nurse examiners, and myself in particular, is really important. When I talked before, I think I talked a little bit about how less than around 40%, like the numbers are like 16 to 40% of patients that are sexually assaulted seek health care after the assault, when 100% of them can have long-term health consequences in their life for the rest of their lives from this assault. And to me, that means that we're failing as healthcare providers to get people the care they need. And that breaks my heart. It breaks my heart. It doesn't mean that it's specimens that can be collected in a box. It means that somebody who's a healthcare provider that's trained and understands what's happened to them can be able to intervene and be able to prevent some of those long-term health consequences. I think that too long, healthcare in general has relegated sexual assault to be a criminal justice issue and not a health issue. And that's so wrong. That is so wrong. It's really important to me that healthcare turns itself around and sees that these are patients. And often what we see many years later in substance abuse, in unwanted pregnancies, in sexually transmitted infections, in mental health problems in the individual, those all could have been prevented and stopped making our emergency departments overflowing with people if we look at the violence that they may have experienced in their lives and try to intervene earlier. And try to intervene. If I am the first person that treats that patient decently, then that's a win to me.
Sarah Deer, Professor of Law, University of Kansas, Kansas.
One example that I can think of is that a lot of survivors of sexual assault who are Native want to smudge light sage, which is a cleansing ceremony that could be very appropriate in the aftermath of trauma. And a lot of times our hospitals aren't really set up to allow something like that to occur. So when we have traditional people involved in a SART, they can communicate the needs of survivors from that community. And I've worked, for example, in a hospital that was able to, just for a few minutes, turn off the smoke detectors. Sometimes the fire marshals don't like that, but it allows that survivor to engage in that ceremonial experience right there in the hospital. So that communication between the traditional leaders and the hospital staff or the fire marshal can sometimes create these avenues for modification of a traditional SART to meet the needs of that particular community.
A quote appears, "If I am the first person that treats that patient decently, then that's a win to me." Kim Day. Find out more at www.nsvrc.org/SART Toolkit. Special thanks to Kim Day and Sarah Deer. Copyright National Sexual Violence Resource Center 2018. All rights reserved. This video was produced by Dash and Thompson under grant number 2015 VF-GX K003, awarded by the Office for Victims of Crime, Office of Justice Programs, U.S. Department of Justice. The opinions, findings, and conclusions or recommendations expressed in this video are those of the contributors and do not necessarily represent the official position or policies of the U.S. Department of Justice.